I'm Tatasha Springer. My husband is Tony Springer Jr. and the little one is Tony Springer III. We're from Columbus, Mississippi.
Baptist is fortunate to have a maternal fetal medicine service. The way this works is that the obstetrician can, from around the state, can call into the hospital, and if they have a patient who is at risk for premature delivery, or they're expecting complications with the baby, they can talk to the perinatalogist or maternal fetal medicine specialist and arrange for transport to Baptist for continued care of the pregnancy. And certainly, should the baby have to be delivered, then we have our Neonatal Intensive Care Unit to take care of the baby. So this has been a very successful service. We feel like the patients have greatly benefited. It's much preferred to transfer the mother and have the baby delivered at the hospital where the baby is going to be cared for than to transfer the baby after birth.
This is my 7th pregnancy. I had 6 miscarriages. So we kind of got all that worked out now, but it's just been a long road, and we finally.
It appeared that her membranes had ruptured, and there was she had developed some fever. There was a concern that an infection had occurred inside her womb, chorioamnionitis, and this almost seemed to remove any chance of survival that her baby could have to be born that premature and potentially infected on top of it.
Well, I was nervous because it had happened before, and around about the same time, I was maybe a week further along this time, and it was the same thing, water breaks, but it always would just be like a week or 2 weeks later before the baby would ever come. And so I'm just so glad that this time I was here and they were able to, do everything they could to save him.
The mother-in-law was praying aloud for each one of those things I would say. So for example, I would say, the brain can easily bleed, and she would say, "Dear Lord, protect this baby's brain." And I'd say, the baby could have problems with his eyes, and she would pray for Tony's eyes. And then all the way down from the lungs and the heart and the stomach and skin and everything else. Everything that I told the mom could develop a problem, her mother-in-law was praying for. So he came out, and we just decided he looked big enough that he could possibly be resuscitated, and we decided to make the attempt. I put a little tube into his windpipe, and it fit, thank goodness, because otherwise we'd have had some problems. And we gave him medicine in his lungs, and we went from there. We moved him to the ICU, and thus started Tony's life outside his mother.
He weighed 1 pound and 1 ounce. He had one scare, and they thought that he wouldn't make it through the night after he was maybe about 3 weeks. And the next day, he turned around and he started doing good.
Baptist was the first hospital in town to really focus on developmental care and family-centered care. For a number of years, Baptist has had better, 50% or better outcome for 23-week babies, which historically, the average in the U.S. is 30% survival in that age group. Our data, our outcome data, not only our mortality data, but also the health of the babies when they go home is measured and compared in the Vermont-Oxford network, so to the rest of the country and indeed the world. So we have a good sense of how we're doing comparatively, and we do very well. We're very much into the newest trends in quality improvement and quality care and measuring quality outcomes. But sometimes there are instances where the family, the baby, the issues surrounding it, the history, everything sort of conspire to make the story stand out it affects you very deeply. And they all do, but this was a very special story. The fact that the family was so hoping and praying for a successful outcome, the tragedy they'd been through with previous pregnancies, how strong the family was, not only in their bond together on both the father's side and the mother's, but also their faith, and it was simply remarkable, a very remarkable story.
Okay, here we are, July 12th, 4 months later, and he's finally getting ready to go home. Everybody's excited, and we're just so ready for him to come home. Everybody's been hoping and praying for him, and the day has finally come. He gets to go home Friday.